أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. My brother and sister, I welcome all of you with Islamic greeting. Assalamu alaikum wa rahmatullahi wa barakatuh. May the peace, mercies and blessings of Allah be upon all of you. The topic of today's program is the widespread of sickle cell anemia in Nigeria. The widespread of sickle cell anemia in Nigeria. This topic is being we have discussed it in our language Yoruba, but today my mission is to discuss it in English in order to make it an advantage and benefit for every one of my people in Nigeria. Sickle cell anemia, a disease of the blood, popularly known as SS. Sickle cell anemia, SS. The widespread of sickle cell anemia, not only in Nigeria, but our concern is about how the outburst, the widespread, the pandemic of this disease, despite the campaign against it, it's increasing every day. That is the reason why we are taking out this topic, not only to showcase some of the natural solutions to reduce, to manage, to cure this disease. Sickle cell anemia is a disease of the blood. Is an inherited disease, a disease that the offspring inherited from both father and the mother. It's a disease that both medical and natural research agree that is not a disease that someone can affect people with. It's not a disease that someone can contact. It's not a disease you can spread to other people like a virus, and it's not a disease someone can spread it through spiritual means. Sickle cell anemia is a disease contacted through inherited blood from the father, from the mother. Especially when two abnormal hemoglobin coincident, jam together to form an offspring that is when you have a sickle cell anemia. Sickle cell anemia is a disease. I take it again. It's a disease that no one can inflict it on other people. Sickle cell anemia is a disease that no one can inflict it on you. If you have a sickle cell patient, you can't think it's as a result of witch, as a result of wizard, as a result of maybe you do bad somewhere, or as a result of revenge. It's a disease that only, not other means, that can only occur as a result of two hemoglobin gather together to form an offspring. The hemoglobin I'm talking about is when normal hemoglobin is hemoglobin A, abnormal hemoglobin is hemoglobin S. So when abnormal hemoglobin, the father has, especially when the father have hemoglobin AS, and the mother also have the same thing, hemoglobin AS, and these two AS come together to form a baby. There is 1 out of 4 chances that they will have a baby with these two abnormal hemoglobin, which is hemoglobin S. That is why we have SS. That is sickle cell anemia. Hemoglobin is very important in a human body. Is one of the a kind of a protective acid flowing in our body, especially in the red blood cell. That hemoglobin is the one that monitor the flowing of oxygen. But in this sickle cell anemia, this hemoglobin will be abnormal. It will not allow the pliability of blood to flow normal, because the shape of red blood cell is like a donut, like a circle. When it occurs in sickle cell, means it will turn to something like the half, like half of a moon, like half a curve. That is when you have a sickle blood. My brother and sister, what are the causes of sickle cell anemia? Actually, where I'm driving to is how to showcase, how to let people understand that sickle cell anemia is a disease that medical doctors have exhausted their capacity, and the outcome of their research is that there is no any medical solution for it. The moment you have sickle cell patient, you have sickle cell baby, there is nothing you can do than to be managing the baby until the baby will die. What necessitates this research is that there is one particular hadith of the Prophet sallallahu alaihi wasallam. To say the fact, there is no any hadith or verses of the Quran that directly mention the word sickle cell anemia. In Arabic, the word sickle cell anemia can be synonymous or translated as fakru dammu al-munjaliyu, the disease, clotted blood. There are some hadiths where Prophet sallallahu alaihi wasallam explained about the blood, the clotted blood, the congealed blood, the disease of the blood, which is anemia. But the word sickle cell anemia does not appear in any of hadith and Al-Quran. Despite that, there is one particular hadith of the Prophet sallallahu alaihi wasallam which says, "Ma anzalallahu dahan illa anzalallahu lahu dawa, there is no any disease in this earth. There is no any disease without solution. This prompts a kind of challenges to scholars. How are we going to face this? How are you going to defend the challenges upon the hadith of the Prophet sallallahu alaihi wasallam? Sickle cell anemia is a disease, and the doctors, the medical practitioner believe there is no any solution for it. The baby will face different episode of pain upon pain, depending upon how they manage the patient. Despite the fact that the Prophet said there is no disease without cure, how are we going to face the challenges to procure, to provide, to create something as a natural medicine, to create a remedy for a disease, for some disease that medical doctors concluded conclusively that there is no any solution for it, such as sickle cell anemia, such as stroke, such as hepatitis B, such as kidney failure. There is no any solution for kidney failure in hospital except a dialysis, and a dialysis is not a cure. It's not a management for kidney. Dialysis is a way of prolong your life. It's like they wanted to time your life, that oh, you will not die this week, come next week. There is no any medical inclination in dialysis except they will help you to filter the urine away from the blood, and they will return it. Those are some of the challenges on Skola. That is why Skola Research Islamic Foundation took it upon themselves to look at some of these challenges in order to defend the hadith that there is no any disease without solution. That is why I can categorically, authoritatively tell you, and I can authoritatively, boldly read the hadith anywhere. No matter who you are, I can read it in front of you. The question you will ask me, okay, the Prophet said there is no disease without cure. Do you have cure for hepatitis? Do you have cure for stroke? Do you have cure for this and that? I will say yes. Because there is a research carry on every day to look into this disease that there is no medicine for it in hospital. So now, based on the discussion on ground, the word sickle cell anemia is a disease that creates different of pain to the patient or to the child, to the offspring, due to the abnormal hemoglobin from mother and abnormal hemoglobin from father that the offspring inherit from them. What are the factors responsible for sickle cell anemia? I beg all of you who might have seen this program, help us to share it. We have nothing to gain but to assist, to help your neighbor who might have sickle cell anemia, and also who might have planned to get married. Let us share it. May God reward all of us. Some of the factors that increasing the spread of sickle cell anemia, I want to mention like 4 or 5. The first one is ignorant about premarital test. Ignorant about premarital test. Some people don't know the effectiveness, the necessity of premarital test. You need to find someone. Al-Quran says, "Fankihu ma taba lakum minan nisa." Marry those people that suit your taste. Marry those people that you will marry without regression. If you don't do marital test, you will not be able to assess, you will not be able to know if the wife you want to marry, you are compatible or not. The compatibility test, especially in the blood level, you may look at the woman to know if the woman is beauty or not. You may look at a woman, if the woman is fresh, if the woman is from a good home, if the woman has a good attitude, but you can never understand, you can never aware of the blood except you go for premarital test. You do your own. Maybe you are AS. Don't risk it. Whoever you want to marry, let the person go and do his or her own, in order not to fall into marital incompatibility, which will lead you to episode of regression, which will lead you to a kind of bankruptcy, because all of your money you will exhaust it in hospital. Aside from that, aside from financial problem that this will cause you, your child, there is no money, there is no influence, there is no power you can have to control that child without having witnessed different kind of pain. That is the reason why we are trying to let people know that the only way to stop the spread of sickle cell anemia is for every one of us to be doing premarital test. The moment you do premarital test and you believe the result shows that you are free, you are compatible, AS can marry AA. AA can marry AA. AA can also marry XS. You will not have problem, except you as AA, you will be nursing the problem of your spouse. You are the one to be taking care of the spouse, which is SS, but your baby will free from the problem. But AA cannot and will not marry, AS cannot marry AS due to the circumstantial inexactness, because AS is a kind of hemoglobin. One is normal, one is abnormal. The one that's normal will make the father or the mother that has AS to live a normal life, but the S inside it, when they produce it, and when the father or the mother throws out and it meets with another abnormal hemoglobin, the baby will suffer the whole life of the problem. So one of the factors that prompt the widespread of sickle cell anemia is ignorance about premarital test. I shows a lot of different topic, a lot of program, a lot of discussion about its significance and importance of doing premarital test, of engaging yourself in doing premarital test before marriage is very, very important, not only to save your life from having sickle cell anemia, but also to prevent yourself from cutting from different contagious disease which might have been in the spouse you want to marry, such as HIV, such as hepatitis B, such as gonorrhea, such as staphylococcus such as genital wart, among many other. Before you can get married with a lady, or before you can get married with a wife, make sure you do blood compatibility. Let the person do tests, different episode of test. It's not that you don't love the person, but you love yourself than him. But if you know that you love the person than yourself, you can engage yourself in marriage without any prerequisite, without any premarital test. But you are going to regret it one day. I'm aware that some people married without this test, and some of them narrowly escaped without having sickle cell anemia patient. I even aware that some people were AS and they were married and nothing happened. They have 4 children without problem. That is a miracle. That is a narrow escape. What I'm telling you is something that you cannot be able to prove medically, psychologically. You can't defend it. If someone asks you, you have a baby with sickle cell anemia, it's not a disease they can inflict on you. It's not a disease. It's not a spiritual disease whereby you will be blaming witches and wizards. If you have a baby that you are carrying to hospital maybe every week, every month, or different episode of pain, don't say it is somebody that is doing you. Don't say somebody causes it. It happened as a result of incompatibility of your blood with your spouse. That is why I'm calling my brother and sister in Islam. One of the factors responsible for the spread of this disease is ignorance about premarital test, compatibility test. Some people believe it's against the teachings of Islam because the Prophet in anywhere did not mention going for premarital test as a prerequisite of marriage. Yes, I'm aware, but there is one particular hadith whereby the Prophet sallallahu alaihi wasallam made mention of prerequisite of marriage. The Prophet mentioned 4 things. He said, "Tunka ulimariya le arba'a." You can marry a lady or you can engage yourself in marriage with 4 things. The first one is linasabiya. You must know about the spouse, the opponent, the wife you want to marry. You must know about their historical gene. The Prophet said that there is no science then, but the Prophet mentioned that sallallahu alaihi wasallam, if you want to marry, there is something called prerequisite of marriage in Islam, and the Prophet sallallahu alaihi wasallam made mention of 4 things. The first one, the Prophet said, "Tunka ulimaraha." You can marry a lady li arba'a because of 4 things, because of 4 prerequisites. The first one is linasabiya, our family. Some scholars translated it into a family, but this family, what the Prophet was saying is deeper. A family means you need to trace the theory, if possible, for you to know the genotype of the father of the wife you want to marry and the genotype of the mother. In the first filament, they born their baby, then you will be able to know that the Prophet was saying something about the genotype. He said, marry a lady, linasabiya, to know their historical genealogy, know their background, their blood, because the Prophet also said in one hadith that the blood is contagious. The blood can trace the genealogical history. The Prophet also said, linasabiya, lijamaliya, you can look into the beauty of the wife you want to marry. Limaliha, you can look into the financial influence of the wife you want to marry. And also lidiniha, the Prophet now said you need to be prioritize the religion aspect of it. What am I saying? Some Muslims, due to the ignorance, due to their ineffective interpretation of the hadith of the Prophet, they will say there is nowhere in hadith where the Prophet said go and do premarital test before you marry. Yes, we agree, but there is no hadith that made mention of sickle cell anemia. which can lead us to agree that there is no sickle cell anemia during the time of the Prophet sallallahu alaihi wasallam. There is no hadith that mentioning the name of HIV during the time of the Prophet sallallahu alaihi wasallam. There is no hadith that saying anything about sickle cell anemia, hepatitis B. If this is what we don't have during the time of the Prophet, and the Prophet says something similar, somewhat similar to what is happening now, it's something we can infer, it's something we can understand, it's something we can prefer, it's something we can give, we can notify ourselves into it to let people understand. Don't kill yourself the moment you marry a lady without premarital test, and the lady is having a kind of abnormal hemoglobin, and you also have it. You will cry, you will regret. And the Al-Quran sallallahu alayhi wa sallam warn us. Almighty Allah says, don't use your hand, don't put your hand into a manaku, don't handcuff your hand, don't lay your hand into something that make you to regret. That is what I'm saying. The factor responsible for the sickle cell anemia, one of it, the spread of sickle cell anemia, is ignorance about premarital test. Ignorant about premarital test. Another factors that increase the procreation of sickle cell anemia is cultural belief. Some people believe they might be Muslim, some might be maybe in other faiths, or their cultural belief, they have some background, they have some historical fact about their marital processing. If they want to marry, they can go to an herbalist to check if both the wife and the husband to be, they were compatible. Yes, there is cultural belief like that. In Yoruba land, in many other parts of the country, they will, even the father of the man will take the man to an herbalist to check, to foresee, to cast what will be the gain, what will be the outcome of the marriage. And this herbalist will do the cast, will do the foreseen processing. He will tell them something. The man can say, oh, you, your son, you, the wife, they are compatible, they can marry. The day will good, the money will good, the night will good, they will sleep well, they will have a baby, they will have money. And this herbalist does not have any scientific, a scientific advancement, a scientific knowledge about anything about blood. There is nothing in this world you will put together to know the blood in a human being. You can never do that. If you try that, I will tell it that you know about science. That is what we are saying. We can't totally condemn science. Some people will accept some scientific advancement and they will reject some of it. Those people, instead of them to go to hospital, to go to lab to know the compatibility of their blood, they will process it in an herbalist house. The herbalist, we can see it through the sun. They can see it through the using of testbar, through some other means. And they will tell, oh, this is good, the wife is good, it's a good girl, it have a very white life, it have a very star. Yes, the marriage may be good, the wife may be good, everything may be good, but what is the major problem is the consequence of you having a incompatibility blood, which will lead you to have a sickle cell anemia. If you have that, you lady, you are going to regret a lot. A man can go out to marry another one, he will get another lady, he will get another son, he will get another offspring, but you as a lady, you will cry. If someone, you are dating yourself and later you observe that your blood is not compatible, and you are begging the man, don't beg them, separate, Don't do something that will make you cry in the future. Cultural belief is another factor that is making people to fall into the trap to have sickle cell anemia patient. In case of the time, because of the time factor, the research shows that out of 100% sickle cell anemia patients in Nigeria, only 20% were non-Muslim, especially Christian. The rest were happen to be from Islamic religion side. Why? Because it is part and parcel of ideology in Christendom that before you get married, both male and female, the husband to be and the wife, they will go to the pastor, they will go to their pastor to do a kind of solemnization. Before the solemnization, before the contract will be signed, the pastor will ask for prerequisite of marriage. The pastor will ask them to produce the premarital test. If you are not compatible, they will separate you from church and nothing will happen. This is not happen in Islamic side. We conducted a lot of research. A researcher took us to different hospitals in Nigeria. A researcher took us to look for the baby, to look for sickle cell anemia, in order to see, in order to observe, in order to listen to their story, in order to know the causes, in order to know the consequence, in order to know how they are being treated, in order to know how they are being frustrated, and the kind of pain the episode of pain they are encountering. We went to different states across the world, across the country. We are able to gather the fact that 80% of sickle cell anemia parents were Muslim, because when Muslim want to marry, there is no Islamic organization, there is no any non-Muslim any Islamic organization that we act for a premarital test before the marriage. There is no. If anyone, we are trying to carry a campaign to help us. We are writing a letter to some Islamic organization, some of association, that whenever you want to conjoin a wife and husband, try to look into their blood compatibility processing. Let us, before you can conjoin people, before you can solemnize them, before you can sign their contract, did you as a malam ask of the premarital test in order to show that you want them to live a good life? If you go to church, they have a medical window, a medical section in the church. There is nothing like that in Islam. They can start it today or tomorrow, but I'm telling you, and if you want to carry the research, the door is open. I conducted my own research, and we see what is happening. We want to stop the procreation of sickle cell anemia. For federal government is doing all the capacity they can to make sure there is no baby that have such disease, a disease that cannot be treated in hospital. But federal government cannot control the marriage. Federal government is not the one to solemnize the marriage. Federal government is not the one to sign the marital processing. It is you, Malam. It is you, Islamic organization, that you can respond. You can carry the campaign. Whoever who want to marry, just sit them down. You need to have a counselor, a marital counselor in your Islamic society. Let someone learn about to become a marital counselor What is the outcome of your marriage? Why do you want to marry? What kind of love? Do you know love? What is the character? What is attitude? Someone supposed to be in charge of that. They are having it in hospital. They have a medical doctor of eyes in hospital. They have a marital counselor in hospital, in church. But in Islamic side, we are trying to let people know, if they want to marry, you don't need to interfere into people's affair. But when they come to you, they need that in front of you. Malam, I have seen a wife I want to marry. This is the wife. I don't ask you to reject them. Just ask them to go and do premarital test. If they were not compatible, just remove your hand as a malam. Because you are going to reject, you are going to regret it also. You will be the one to pray for them in hospital. You will be visiting them in hospital. That is where I'm going. Sickle cell anemia is a disease that occurs as a result of two abnormal hemoglobin conjoined together to form a baby. Sickle cell anemia. If you have one in your family, or the whole family will hate the parent. The whole family, they will hate the parent because the baby will not let them to sleep. He can have the attack in the midnight and he will be crying, saying something that will make you cry. Oh, daddy, why do you bring me to this world? Can I kill myself? Which kind of pain is this? Something that will pain them. All right. Having said that, the necessity of this program wanted him to showcase how to treat sickle cell anemia patient. The solution. The first solution I want to say is the medical doctor way of treating it. In medical facility, the only way to help you to subdue the problem of sickle, not to cure it, to subdue the problem of sickle cell anemia is through transfusion of blood. The baby will be going to hospital to get blood. He can receive blood as many as it's needed. When you give the baby a blood of maybe AA, they transfuse it into his body. The blood will turn to SS after a month, because the liver contains our DNA, and DNA is what we know as deoxyribonucleic acid. This DNA is inside our liver. That's why no doctor can tamper the liver. The moment they cut anything from your liver, you will not be as you be before. You will not be yourself again. Your stomach might swell out. You may change your character, because what is you inside you is your DNA. The DNA that separates you from your parent, the DNA that separates you from your own blood brother. The DNA is a character, is a gift, is a number, is a label of your own self. So this DNA, the moment this DNA contains the kind of blood you brought, the kind of character you brought, the kind of attitude you brought, the kind of yourself to produce yourself, to monitor yourself. So when they transfuse the AA blood into the SS blood, after a month, it will change to SS. Having changed to SS, the baby will start having some difficulty again, because of the pliability of blood. We become sickle. The blood supposed to be rolling like a small ball, like a donut shape, rolling down, rolling up to return to the liver, rolling down, rolling up, return to the liver. Some of it will roll down, some of it will roll to the brain. The brain will assess the one in the one going to the brain will change, will transform to blood glucose. The brain is not using the blood direct, but the glucose. It will change like a oil, the oil that will make your engine in the upstairs, the one that infuse the corpus callosum in the upstairs, the one that make you to normal. The moment you have a problem with the blood, with the transmission of blood into your brain, you will be feeling some pain downstairs. I mean, your hand, your body, your I mean, you may even have a kind of arthritis. That means if your brain cannot access normal blood flow, you will have a problem in the downstairs. There is something called in modern biology, our brain, the right side of the brain is working for the left side of the body. The left side of the brain is working for the right side of the body. They call it transactional function. Transactional function. The one here is working for the one here. Now this brain to work normally needs blood glucose, and a normal human being needs to produce blood glucose to the upstairs for the brain to access normal and function normal and make all the general body to function normal. But in the case of sickle cell anemia, there may be a blockage in their vascular occlusion in their heart. They may have a problem that will make the patient to have a kind of inflammation in the chest. This means the blood that's supposed to pass through the jugular vein to transform to blood glucose has been blocked somewhere in the chest. So this, in the upstairs, they will not have a normal circulation. They will not have a normal response to transmit the functionality to the other body system. What am I trying to say? If you look, if you are a scholar or you are a doctor, if you look into the problem of sickle cell anemia and you have a baby in front of you, you can even carry the baby, and nothing will happen. But he himself will generate a problem for himself, because the blowing of blood that's supposed to be rolling like a donut shape, like a coin, we now divide into two to be a kind of half of a coin. So when one is rolling, the other one will be coughing it, disturbing it, until the blood, the pliability will become sickle. That is where they said sickle cell anemia, something that congeals somewhere, cause a blockage, block the pliability of blood. That is what we are trying to say, my brother and sister. What is the solution? The first solution in the hospital is the transfusion of blood. No matter how you do it, no matter the consumption of blood the baby took, it will get the attack maybe after a month. You are not, the blood pints now is like 18,000. So this week you pay 18,000, maybe 2 blood or 3. Next week you are coming. Next month you are coming. Look at the problem you want to enter. If you don't do premarital test, you are going to bankrupt your financial capacity before having it. Another solution in medical line, they call it transplantation of bone marrow. They can transplant a bone marrow. That's another solution. This one also, in fact, they will touch the femur bone, the longest bone in the body, in the thigh. They will touch it. They can cross it. They can change the marrow, the bone marrow inside it. They can do whatever they want to do in order to open the channel, to open the normal channel for the baby. If they do it, it's not total cure. It will make the baby to live normal life for some time, for some months, some years. That sickle character will return. And some medical practitioners use maybe to give the baby a water to flush the blockage, something like folic acid, something like that. I'm not here for that. What is the work of Skola Islamic Foundation towards sickle cell anemia? Having gone for research on a different note, to know the causes, to know the kind of blood, to know how it occurs. There are some disease you can I mean that can a contagious disease you can caught somewhere. There are some infection you can get somewhere. There are some natural disease, a phenomenon, a natural you can caught from natural phenomenon. Maybe a kind of a air, a kind of a oxygen overblown into your face. It can block your hair, your sight. It can make you to be coughing. It can make you to have stroke. That is some of disease you can get from natural phenomenon, or you can contact from the subject. But sickle cell anemia, there is nothing like that. You can't contact it somewhere. You can't get it. The only way to get sickle cell anemia, if you see sickle cell anemia, baby, that means no other means. The father is AS and the mother is AS. They have different hemoglobin. They have two hemoglobin. Hemoglobin A and hemoglobin S. The mother have hemoglobin A and hemoglobin S. The conjoin of that abnormal hemoglobin produce the offspring known as sickle cell anemia patient. So now, I want all Nigerians to understand something. What is it? Our mission is not to destroy the credibility of medical doctor. Our mission is not to tamper with what they are doing in hospital. Our mission is not to antagonize the ideology of medical practitioner. Not at all. But we are trying to create a parallel medicine. We are trying to create an alternative means, especially to support, especially to add to what they are doing in hospital. And not only that, we are trying to create a kind of alternative way of getting a therapy in order to stop monopolistic propaganda of medical doctor. They don't know they don't know how to treat some disease, and they will claim to have known it to collect money to destroy you. A disease like diabetes, it cannot be treated in hospital, my brother. They will be treating you until you die, until you get a wound that will not be healed. All the medical pill for diabetes is a wrong medicine. It's not good. If you are a man and you are taking medical pill for diabetes, your penis will destroy one day, your sight will go one day. It can lead you to have a kind of arthritis, because when this medical pill dissolve, the remnant of the medical pill will still remain in your body. It will now be looking for a way, it will be looking for a way to stay. It will be looking for somewhere to hide. Treating diabetes in hospital is a waste of time. Hypertension, there is no any medical pill for hypertension. They will be managing you, giving you medical pill. They can give you in a basket. They can give you in a poly bag. You'll be using it. This one 2, this one 1, this one 3. You will use it until you die. Look for solution. This is what Skola Islamic Foundation we are trying to do. We are not here to antagonize any medical doctor. We are not here to flood their credibility. We are not here to tackle them. But our mission is to create a parallel therapy. To create something that will go side by side. It's either you go to hospital or you go to look for alternative medicine. I'm not here to advertise, but I'm purposely, the Skola Research Islamic Foundation has a mission to stop the propaganda, a kind of monopolistic propaganda of medical doctor. They will say if you drink something that is bitter, your liver will be destroyed. It's a kind of propaganda against herbal cure. No doctor can say that. I will never accept it. I will ask the doctor to produce a patient that use herbal and the herb destroy the liver. Now I will give them enough, more than enough. Many people that use medical pill and it turned out to destroy the kidney, it turned out to destroy the liver, it turned out to destroy the eyes, it turned out to destroy the penis, it turned out to block fallopian tube, and many of that. There are many medical pills that has many disadvantages. If you want to know that, whenever they give you a medical pill in hospital, just try to put the name on the Google and put reaction of so medicine. You will see the reaction or the side effect of so medicine. You will see what you will see. So I'm not antagonizing any medical doctor, and I'm not facing them. It's their professional. They were trained to treat people with medical pill, use of shrink, use of ideological based on scientific idea. I'm not after that. My mission is to stop a kind of monopolistic propaganda. My brother and sister, herbal medicine can cure diabetes. Herbal medicine can cure hypertension. There is herbal medicine for kidney problem, kidney stone, kidney failure. You can ask me, I will prove it. There is herbal cure for something like a stroke, to revive a stroke. When they collect money in the hospital for a stroke, after 2-3 weeks they will ask you to take the person to physiotherapy. They are sending you out. They don't have the cure. It's a waste of time. And they are trying to carry a kind of a propaganda against natural medicine, a medicine given to us by Almighty Allah. If you don't believe it, that the Creator that create all the creation give us a medicine, a natural medicine. He is the one that know whatever will happen to us. He gave us different leaf, different stem, different categories of medicine you can generate from leaves and stem. But you leave what Almighty Allah, the one that created you, you overlook what He gives you, and you appreciate what somebody, the idea of somebody, the theory combine, right, prepare by somebody. Help us to share this program. God will reward you. You appreciate a theory written by someone, written by a researcher. And a theory, according to medical practitioner, a theory is an hypothesis based on assumption. Let us use this. Let us add potassium. Let us add glucose. Let us add this. That's how they generate medical pill. But there is natural solution for everything. There is natural solution for it. I'm aware that some people are producing herb in a wrong manner. I'm aware of that. That is not what I'm saying. If you want to buy herb, you want to look for herb, look for somebody who is perfect. Look for somebody who is in the field of producing herb. Look for somebody who was trained to produce herb. Not somebody who will tell you if you buy this herb, it will cure diabetes. At the same time, it will cure hypertension. All those herb is a flaw. All those herb is a killing. I know that. A herb that we be using for a diabetic patient can never be consumed by any other person without diabetic problem, because a diabetic problem is what they known as hyperglycemia. When your sugar is high, but when your sugar is low, it is hypoglycemia. Hyperglycemia and hypoglycemia is a two different problem. If your sugar is high, it's dangerous. If your sugar is low, it's dangerous. Now the sugar that you, the ABA that you created for someone that has hyperglycemia, diabetes, you are telling the person without this problem to use it. That is a problem. That is where some medical doctors are able to combine their propaganda. But my brother and sister, when you go to hospital, the doctor will say, don't drink herb. Don't drink herb. Don't drink herb. Nobody will force you, but you are going to regret it one day. When the doctor will just write, oh, we lost him, we lost her, sorry, that is their, nobody will tamper them. They have certificate that back your death. If you die, they have certificate that back it. In another sense, some people believe to appreciate medical doctor to the extent that if they gave you something, they ask you to go and do ECG, a kind of scan, you spend like 200,000. That thing is not helping you anything. It's just to make sure you see the place of what is happening to you inside and outside. Yes, we appreciate that. We believe that. We agree with that. If you have money. But when you return, the doctor says, oh, this is what happened to you. Oh, yeah, go and buy this drug. Everything is maybe 70,000 or 40,000. You buy the drug. After a week, you go back. This drug is not working. You say, oh, just drop it. Go and buy this. How long are you going to buy this, buy this, buy it? But if you go to an herbalist or an alternative medical doctor, or an alternative doctor, and the person gave you something, some people will just use it in 2 days and say, hey, it's not working. Oh, you are 419. You will never call a doctor a 419, and you can call an alternative doctor a 419. I don't want to be diverted, because we are on sickle cell anemia. We want to provide a natural solution for people. Now, having said all this, I want you people to understand sickle cell anemia is a problem occur as a result of conjoined hemoglobin, one from father, one from mother, which be together in an offspring. What is the solution? We have tried a lot of solution to treat sickle cell anemia patients. Please help us to share this program. We have tried different form of solution. Different form. We have tried different form of solution. Especially in Islamic way. There is something called Al-Ijama. Al-Ijama is what we know in Islamic religion as coping therapy. The coping therapy is the use of suction, a kind of a cup, to remove a congealed blood, an excessive blood flocked together somewhere. You can put a cup by doing maybe a wet cupping, a dry cupping, hot water cupping, and some other like that. We have tried it on many patients. There is limit to what cupping can do for a sickle cell patient. If the patient is crying, having a pain in the thigh, in the leg, oh, I'm having it, the patient will be asking you to even cut the leg. If you do hijama, it will not work, because what is happening to the patient in the leg is not a blockage of blood, but in the bone marrow. After the bone, we have 3 layers of the flesh. After the flesh, there is another layer like a whitish color covering the bone. So after the inside the bone, that is where a blockage occurs. That is where they call it a bone marrow. What is inside the bone? So you can't use a German to treat that. Don't disturb yourself. I'm telling you an outcome of research we conducted. You can't use ijama for sickle cell anemia patients that have a kind of vascular occlusion, a kind of heart problem. The blockage occur in the heart. The patient is now crying. Is now crying seriously that this thing is paining me in the heart. You can't use ijama. You can't place ijama on the heart. The person can have heart attack. You can't place it on ijama. You can't do. Please, I want you to get it. You can use an ijama, a coping therapy for a sickle cell anemia, but there is limit. You can't use it to treat heart problem. You can't use it to treat a kind of attack occur in the brain channel. Maybe the person is suffering from a typical headache. The eyes will change. The eyes will change because the brain is lacking a blood glucose. You can't use ijama to drag out the blood. It can lead the patient to have a kind of cerebral malaria. It will turn them to have a kind of brain problem or bipolar, because it's lacking a blood glucose in the brain. That is the problem. But because you have ijama, you want to drag out the blood, you just place ijama on the back of the neck and you drag the blood that remain, that the brain is also generating by itself. You are now dragging it. It can make them to have a bipolar or a brain disorder. So there is a limit to what you can take ijama to do. That is number one. You can use ijama for a sickle cell anemia if you see a kind of rheumatism, maybe in the joint like this, something come up, swell up in the joint. You can place ijama on it to drag out the blood. But when you don't see anything, it will not swell. The patient is crying that something is paining him inside. Don't use ijama. That is point number one. Number two, you can also use rukia. Rukia is another means of treating sickle cell anemia, but there is limit to it. A rukia is a separate prayer given by the Prophet sallallahu alaihi wasallam to all Muslims to protect themselves, to revive themselves, and to make sure they are living in good health. If you believe sickle cell anemia can be treated with a rukia, that means you conclude that a patient with sickle cell anemia is having a problem as a result of a gene. Because rukia is meant to remove a gene, to cast out a devil, to return the baby to normal position. But this one is not, it has nothing to do with a spiritual inclination. It's as a result of blood clots. A clot blood, a sickle blood that did not have a pliability to move. That's number two. The first one is an ijama coping therapy, but there is a limit to it. The second one is a kind of rukia, but there is limit to it. The third one, and the best one, and the only one to treat a sickle cell anemia is ABA therapy. This ABA therapy is the only way of treating sickle cell anemia patients. ABA therapy. In Skola Islamic Foundation, actually we have a hub, and we have many patients with different attack. But the mission is not to sell this app to people. The mission is to enliven people, is to carry a campaign, is to advise, is to encourage. many other malam to start researching on how to treat sickle cell anemia patient. This beyond what a single person can do. This beyond what a kind of a particular organization can do, because every day the number of sickle cell anemia patients was increasing. A lot of people have pregnancy now, and their offspring is sickle cell anemia, so they are producing it every day. This is why I'm trying to let you know, in your area, in your community, in your organization, in your town, you can start trying how to do a herbal therapy for sickle cell anemia patients. I can categorically tell you, we have a lot of testimony. We have some people who use the herb I'm talking about, and their blood changed from SS to SC. We have some people narrowly, I mean, by chance, their blood changed to AS. And I have some people, their blood remain, I have many people, their blood remain SS, but their blood remain SS, but one S is weakened down. So the baby will not have any problem. He will go to school normal, he will live normal. Some of them were outside now, marrying to different people without noticing. That is where I'm going. And that is what I want people to learn. There is a natural solution for sickle cell anemia. I know of Skola Islamic Foundation. I know of some other people around the town. It may be in your town. I don't want to mention in any name. There is particular pastor who was able to treat a sickle cell anemia patient. I went to interview the pastor. How do you do it? What are the ingredients? Do you have a theory? The pastor said he was able to do it by chance. We can't call that a theory, because before you can get a theory, you need to set a kind of hypothesis. That's why I define a theory as an hypothesis based on assumption. So if you treat sickle cell anemia and you are able to treat them, but you can't define, you can't determine, you can't defend what you use. You are lucky to treat them, but it's not a theory. But whoever who want to use herb, who want to produce herb to treat sickle cell anemia patient, I want you to take note of 4 key points. You must know how to get an ingredient to generate a blood that can powerful to cure a leukemia. An ingredient that can cure a leukemia, an ingredient that can cure polycythemia problem, an anemia problem, a problem in the blood, a blood that can generate blood, because medical practitioners believe the blood in our body, after 120 days, it will deoxygenated. That one will die. We will flush it out, we will purge it out, and another one will be regenerated by itself. But in the sickle cell anemia, this regeneration, deoxygenated and regeneration will not occur. You need to know an ingredient that can make a blood to light it. It's very, very thick, and you want to light it. You need to know, point number 1 is to know an ingredient to treat anemia, a blood problem. If you want to produce an herb for sickle cell anemia, I know many Ava, many scholars, many people, they were outside, they are trying every day. I'm giving you a clue. If you want to get it, use all this formula to add it. An ingredient you can gather to generate a blood, such as ugu, such as ewe ogbo, something of that nature. Now, you need to get an ingredient that can produce a calcium, natural calcium. Natural calcium. you need to have an ingredient that can generate a natural calcium, because this baby was crying, always crying every day because of the bone marrow, because the cartilage in their bone has been went off. You can see some patients of sickle cell anemia, you will see them, they can be having pain in the back, they can be having pain in the knee, in the shoulder, in this, in that. You need to get something that can be a kind of a calcium, a natural. There are many ingredients that can give you a calcium. Let me give you an example. The shell at the back of an egg is a calcium. I'm giving you an example. I want every one of us to start doing the research. No one is an island of knowledge. I can't say the one we are doing is the best. I can't say the one we are doing is the only. There are many people outside there. They were not opportune to come out and say it. But I appreciate alternative medicine than any other medicine. As I seated in front of you, I'm praying to Almighty Allah. I have never visited a hospital because of myself. I have never taken any medical pill in my life. And I'm praying, if I will die, I pray to God Almighty Allah. Because there are many inconsistencies in hospital. I don't say, I'm not attacking any doctor. I'm not attacking any hospital. But I want to save my people. My mission is to save life. People are dying every day. You collect money from them, they will die. You will collect money to take the corpse to mortuary. That is not Islamic. That is not Islamic. Some hospital will be saying you need to pay before you take your corpse. It's not about the money they use to buy medical pill, but the corpse, the dead body has slept in their hospital. They will collect money. Some of these are inconsistent, and it's not Islamic. That is not what I come from. I come for today. Sickle cell anemia. If you want to produce that, you need to get an ingredient that can generate calcium. What I'm saying, either you like it or not, some hospital have a testimony of treating a sickle cell patient, but with natural medicine. Some of them will come to us, hey, Dr. Skola, just produce for 2 people. If you give it to them, they will rebrand it. They will get a small bottle and they will package it in that small bottle. They can tell you the thing come from abroad. They can tell you it came from India. Something they bought from us. A herb for sickle cell anemia is just 30,000 naira, for example. They can rebrand it and get millions from it. They will tell you it's coming from China. You are going to pay for shipping. And when it comes, you will see a different labeling. You will see it, you will see that. They are producing it. They are reproducing it. They are rebranding it. I'm saying it because I want to help my people. I'm saying it on social media. Some medical doctor can do that. The medicine they will give you, they will tell you it came from India. It came from China. It is Nigeria. They produce it in Nigeria. Many of it was produced by a local affair, by a local herbalist. But due to rebranding, reproducing, so some medical doctor asks that. Somebody come here, Dr. Skola, yes, you said no one can treat sickle cell anemia. I have a patient and he's now okay. He's now okay. I will say, what do you use? Said I get some medicine from China. I said, let me see it. So the name of the production, the manufacturer, a kind of natural medicine produced from India, there must be a name of manufacturer. The manufacturer, the company name, everything, the seal and everything, we are going to see it. So I'm telling you to appreciate the work of the malam around your area. I'm telling you to appreciate the work of local Abba, the work of your pastor. Some pastor knew it. They will just get some alkaline water, get some ingredient, they will do it and pray to it for you. If you use it and it's okay, appreciate them. Don't do as if they were local. You are telling the herbalist, you are telling the malam, you are telling the pastor that they were local. But what they produce from this local idea, some medical doctor will just take an advancement, an advantage of rebranding to get it. Instead of you to get something in 30,000, you get it in 300,000. That is your problem. Our mission is to save life. You as a parent, is not about you. What I'm saying is not about you, but about the patient that was born without any accusation. He was in pain because of the mistake of the father and the mother. He was in having episode of pain every day, crying every day because of the mistake of the father and the mother. So those of them, if they pray to God, oh Almighty Allah, let me have my head, don't let me see, don't let me fall down, it will sound as if Almighty Allah did not hear their prayer. That is why all the disease that you knew, there is no any medical pill, there is no any medical solution for it. Come to Skola Islamic Foundation. We are taking it one after the other. We are taking it one after the other. But the number of people that want to see us, the number of people that want what we are selling, is somehow outnumber our power. That's why we are advising people to come out. In 10 years to come, the eyes of everyone will be open. You will realize alternative medicine is the best. But if you want to do this, please, you need to do a practical. You need to learn it. You need to know it. You need to go out. You need to research. You need to conduct a different research. You need to interview. Don't just conclude that this leaf is good. This leaf is good. If a leaf good, a good leaf plus a good leaf, they can come together to become a bad medicine. A good leaf, if you taste it or you use it, it can be good for your body system. Another good leaf that is very good for your body system, but if you mix it together, that is a mixture. If you use it, it can harm you. So before you can come out to produce an herb, before somebody has a baby that is making them cry, somebody has a baby that is making them regret their marital life, you collected a huge amount of money, yet you don't know what you want to do. So if I'm in front to campaign to create a channel for alternative medicine, it's not because of myself. We are doing this for the incoming one. If I'm in front and you are somewhere killing people, doing 419, God will catch you one day. You are going to have such problem that all the medicine will not solve. If you don't know about something, don't say about something. Don't say about it. And to you people that usually come on social media to give a kind of revelation, you need to be very careful. You need to be very careful. Don't give somebody what you knew not about, what you don't know how it is working. I'm very, very sure some people who are there, they will say, oh, a cassava leaf can cure this. Oh, a yam leaf can cure stroke. Oh, if you see lapa leaf, it can cure this. Oh, if you get a bitter cola, it can clean eyes. Something that you have never used, you don't use it for people, you just come on net to confuse people, to create confusion. If somebody gives you something like that, they said if you get a bitter leaf and lime orange, a bitter leaf, lime orange, ginger and turmeric, if you boil it together, you palm it and you boil it, it can do wonder in your life, and you go ahead to do it. Let me tell you something, a combination of lime orange, turmeric and ginger is a poison. It will turn to chemical. If you want to know, get a lime orange, get a ginger, get a turmeric, pound it together, and just drag out a kind of water, a little water, drag it out. Now get an animal like a goat, put it in his mouth, the animal will die. If you open the bowel of that animal, you will see the liver will busted. Those who give a revelation on Facebook, on social media, and you don't know it, you have never used it, God will catch you one day. Don't confuse people. If you can't help people, don't kill people. That is our mission. So in conclusion, I discussed about the definition of sickle cell anemia to have been a disease that occur through the conjoined abnormal hemoglobin S and hemoglobin S. I discussed about the factor responsible for the spread of sickle cell anemia. I said sickle cell anemia continue to spread every day as a result of lack of knowledge about premarital test. Ignorance about premarital test. The second one is ardent faith. A faith that some people has. Maybe I am Alusuna. I will never do what the Prophet Sallallahu Alaihi Wasallam did not do. Yes, I agree. It's a bid'ah to tell people to go and do premarital test. The Prophet did not ask us to do premarital test. When you have a baby and the baby becomes sickle cell anemia, which hadith will you read to mention the name of sickle cell anemia? I also mentioned about the hadith of the Prophet that said the prerequisite of marriage is 4. Look into the family, look into the jamalia, the beauty of the lady, look into the malia, the financial influence of the lady, look into the deen, the religion of the lady. I said what the prophets were trying to say is about the physiological in the blood history, physiopathological of the blood component of that wife. The prophet was telling us, the blood is contagious. You will inherit something from your mother. You will inherit something from your mother. So if a father knows that what he has, he managed to have a good hemoglobin and abnormal hemoglobin, don't look for somebody that have abnormal hemoglobin. It will conjoin to produce your child. The chromosome of the father and the chromosome of the mother will conjoin to produce an offspring. That is what I'm saying. I also say, I listed another factor, that cultural heritage is one of the problems, one of the factors that causes sickle cell anemia, in regarding the fact that the family, the community, they might set some particular tradition. If you want to marry, you need to consult the malam, you need to consult an herbalist, you need to go for people to unseen, to foresee your lifespan, your marital span. So this is totally wrong in Islamic teaching and also wrong to your own life. If you love yourself, do premarital test before you marry. If you don't love you, if you love your wife, if you don't love yourself, you can go ahead and marry anyone. If it happens, you will be among the people that will be crying to God, and it will seem as if the God did not answer you. That's where I'm going. I also made mention of a point that sickle cell anemia did not have any medical solution except transfusion of blood, transplantation of organs, maybe bone marrow or something like that, or using of a kind of some medical pill like folic acid and other. Now I concluded that the only way to cure, to help sickle cell anemia patient is through natural medicine. So some people believe coping therapy can do it. I explained that coping therapy has its limit. It's not everything. You can listen it from it at beginning. I also said some people believe Rukia. If you believe Rukia can treat sickle cell anemia patient, that means you believe, you conclude that sickle cell anemia occur as a result of gene, as a result of spiritual inclination, and that is not right. Sickle cell anemia occur as a result of inherent abnormal hemoglobin. Aside from this, I said the only way, the only means of treating sickle cell anemia is through herb, a herb that will contain an ingredient to generate blood, a herb that will contain an ingredient to generate a natural a natural calcium, a herb that can contain a means to reach the bone marrow, a herb that can contain a way of making a herb that will contain a means to accept excessive oxygen, because the oxygen helps the blood to flow. Oxygen is the blood carrying capacity. I don't want to start again. All this is what I discussed. My brother and sister, fellow Nigeria, especially Muslim, I'm concluding this discussion that the number of Muslims with sickle cell anemia patients is more than the number of non-Muslims. In fact, it is 80-20. 80% of Muslims has sickle cell anemia, while just only 20% of non-Muslim Christian, for example, has sickle cell anemia patient. And those Christians, if you interview them, they did not do their marital contract. They did not sign it from church. They go against the law of church. So my conclusion now is to engage all the Malam, all the Islamic organization. I want you to involve in asking, in encouraging, in advising, in counseling the young husband to be to go for premarital test before going to marry, and let them know what the consequence might be if they go into, if they have wrong marital life. This is what I'm trying to discuss. If you want to call me, my number will be showing on the flow. I remain myself, Abdulkabir Olaya Suleiman. I'm not a science student. That is the question one doctor say, oh, are you a science student? I'm not. I read it in the Quran and Hadith. I develop it, but the fear, the love of humanity push me to continue researching. Research is not because of money. Somebody said, oh, someone said hello, oh, we have sickle cell anemia, we have solution for it, and the solution is 250,000. I just laugh. I laugh because in Skola Islamic Foundation, the package that we are going to give you for your patient is 30,000, because it is going to give you a kind of herb, a kind of calcium, and some other things. So what I'm trying to say in essence is this: this foundation is not meant to gather money. If we need to gather money, some people are giving us without mentioning their name. This is what you are doing. I dash you this. I donated this to the foundation. May God reward me. May God do that. Like one Malam, one Alhaji, he came for kidney problem, and we are able to do it. The Malam said, that Alhaji said in 2020, he said, I have sold all the property I have because I want to go and buy kidney from India. Now you have done it. Can I give you all the money? The director of Skola Research Foundation said, no. Go and use the money to start your life. The man said, I will go. But if you see anyone that has kidney problem, and I'm ready, the man said he is ready to pay half of the money since 2020. So the amount we are doing, we are collecting for kidney solution has been reduced to the half because of somebody who give us a huge amount of money. Those are the things you can do to help Islam from your within. But I'm not fond of begging, hey, please give us money. Oh, if what you are doing did not pay for you, go and do another thing. But this one we are doing, if you have problem and you need solution, those who know me will testify. I will tell you, this is the amount we are going to produce it. I will not add any money. Some people are giving us money naturally. So I remain myself, Dr. Skola, Abdul Kabiru Olaya Suleiman, popularly named Ibadur Rahman. I'm going to end this program today until we'll meet again with another episode, another topic. I'm concluding this program to beg Almighty Allah to let every one of us to remain pleased. Wassalamu alaikum wa rahmatullahi wa barakatuh.